Good afternoon, everyone, and thank you for joining us today. Again, in the Legislative Building in Regina is Premier Scott Moe and Dr. Saqib Shahab. Joining us over the line in Saskatoon is SHA CEO Scott Livingstone. Both the Premier and Dr. Shahab will have brief opening remarks, followed by time for questions. Premier?
Well, good afternoon, everyone. In the past few weeks, we have seen now our highest case numbers to date here in Saskatchewan and in many other provinces across Canada as well. A couple of weeks ago, Dr. Shahab had stated that if we start to see new case averages over 60 cases a day or up to 120 cases a day for a sustained period of time, that we need to consider additional measures. Over the past week, Saskatchewan has averaged 76 cases per day. Therefore, on the recommendation of Dr. Shahab and his team, we are announcing two new measures here today. Effective this Friday, private gatherings in homes will be limited to no more than 10 people. Also starting this Friday in the cities of Saskatoon, Regina and Prince Albert, where many of the recent new cases have been identified, mask usage is going to be mandatory in all indoor public places. These measures will be in place for 28 days and then will be reviewed again at that point in time. I'll let Dr. Shahab provide a little more detail on these new measures in just a moment. Using a mask is an important additional layer of protection, and it will help us control the spread of COVID-19 in our communities. However, we should be under no illusion that a mandatory mask policy will solve everything. Much of the recent spread of the virus in Saskatchewan has occurred in private settings, in homes where we are comfortable and maybe let our guard down, either between household members or others who may be visiting those homes, friends or family, for example. And we cannot let our guard down even when we are just with our family or our friends. In fact, that may be one of the places where we are most vulnerable, because we do tend to relax a little bit and relax all of our other good practices when we are around people that we know and we feel comfortable with. So please wear a mask when it's required, but we all need to do a little bit more than that. We need to continue with our physical distancing, and mask usage does not replace good physical distancing. We need to continue washing our hands and limit the circle that we have of close contacts as much as we are able, and be extremely careful about the food service that we are getting together when we are getting together with people outside of your household. Again, I would say we need to continue to avoid unnecessary out-of-province travel and be very careful if you do travel, even if that travel is within the province. None of these measures by themselves are going to prevent the spread of COVID-19, but all of them together will. We have reduced our case numbers in this province before, and I know that we can do it again, and it's extremely important that we do, because it's how we will continue to keep our businesses open, our schools open, our public services open, and it's how we can reduce the potential pressure in our hospitals. And most importantly, it's how we will all save lives. I know that after nearly 8 months of this, it's easy to think that I'm fine, I haven't gotten COVID yet, and even if I do, I'll probably get better quickly. And that may be true in many of our cases, but it may not be true for the person that you give it to. Your mom, your dad, a grandparent, or a friend. We all have a responsibility to protect one another, and we need to step it up again, Saskatchewan. We need to get these new case numbers back in a better place, and that means being as careful as we were back in the spring. So today I'm asking everyone in Saskatchewan to take that responsibility, to take your personal responsibility very seriously, and to do your part to protect yourself and to protect those around you from COVID-19. So, Dr. Shahab?
Thank you, Premier. So, good afternoon. So, we have 81 new cases today, but also 97 recoveries. So, I think we need to remember that even though our cases have trended up a bit, we can get out of this. And we've seen that provincially, we've seen that locally, for example, in the Yorkton area. We have 842 active cases, and this is a decline from 858 yesterday. But we have seen more than 70 cases a day on average since Friday. So we are trending in that, around 6 cases per 100,000. So we are trending a bit higher. So while we need to be prepared to see higher case numbers through the fall, than the summer, we need to do everything we can to try to stabilize this trend. And even if we start taking all the actions today, we may see our numbers go high for a bit, but then hopefully we can start gently bending the curve downwards again. I think that's what we need to do. And the other thing is that we, also need to understand that we, since many of us are not traveling, we are seeing more cases where people can't identify a source of exposure, and that's why all the measures, all the layers of protection are so important. Not going out when you're unwell, getting tested if you have symptoms. Whenever we go out, maintain that physical distance, wear a mask when you're in an indoor public place and can't maintain that physical distance. All those steps are so important, washing or sanitizing your hands. So as of Friday, we have amended, as of Friday, November 6th, the public health order will be amended, and it will be as follows. So the maximum allowable gathering size for private gatherings in the home setting will go down further from 15 to 10. The 10-person limit does not apply to households with more than 10 family members, but it does mean that irrespective of how many people you have in the household, the total number of people you can have in a home is 10. And however, we still have the ability, our case numbers are such and our transmission is such, we still have the ability to have a larger reception with great care, in a public venue where things can be laid out and there's enough space. We can still go to a restaurant where if you go as a party of 10, you may have 5 people sitting at one table and 5 at another because you can only sit in groups of 6. But we have the ability still to, enjoy, going out to a restaurant or bar. And I think as long as we can continue to follow the guidelines, that is something that we can continue to enjoy and support. The other thing, of course, in the order is that, masking is mandatory now in indoor public places in Saskatoon, Regina, and Prince Albert. And what it really means is that, we heard from businesses that some businesses required a mask, some didn't. This really does level the playing field, and all it means is that anywhere you're going inside, it's not useful to always try to double guess that this business may have enough space and this may not. If you're going inside for 5 minutes, 10 minutes, 20 minutes, just take out the mask and put it on. It's a simple gesture that says, I'm protecting you, because a lot of businesses, they have been wearing a mask to protect you. So, it's a reciprocal gesture, and I think it's the least we can do now that our COVID transmission risk is higher, especially in these 3 areas of the province. But, anywhere else in the province, if you're at a busy gas station, it's a good idea when you're going in to, use the washroom or buy something from the gas station or pay for your gas. Just put the mask on. It keeps everyone safe. So public health encourages all individuals, businesses, and organizations to abide by the masking order to reduce the risk of COVID-19 transmission. We will closely monitor compliance, and enforcement options will be considered based on observed compliance. But really, this is, it's not like people won't be enforcing it right away. We really expect just people to just comply with this in those 3 locations where it's a mandatory, but also rest of the province. And we already have seen increasing mask use. But every percentage point of increasing mask use counts. And if we can get, 80-90% of us wearing a mask in indoor public places, that itself can start pushing our daily case numbers down without any impact on the things we enjoy. So it's a bit of a sacrifice to put the mask on, keep it on for the few minutes that you're inside a business, but that if we all do collectively, it can have a significant impact. So this order will be in place for 28 days, and we will continue to review the need for it to continue, for it to expand, or other changes as required. Today's announcement also includes a further reduction in private gatherings, and as well that I mentioned earlier. And these are targeted to focus on the type of transmission that we're seeing in Saskatchewan. Like the Premier mentioned, most of our transmission is happening in personal gatherings in the home. We've seen some large super spreader events, and obviously, fines were issued there. Hopefully, thankfully, we haven't seen more of those large events happening, but we are seeing ongoing transmission in home gatherings, and it's no one's fault. We like to have that small celebration, a birthday party, maybe getting together with friends. But it's difficult to maintain that physical distancing, reduce that transmission risk in the home setting, and that is why our gathering limits have been reduced to 10. But still, we have the ability to go to a public venue to have that get together, following the guidelines in place there. The other thing, we need to look at is, there's a lot of traffic on the roads, which is good. There's lots of shopping. People are already planning to, start shopping for Christmas. But I think, again, we need to revisit how do we go about, going to work, going to shop. So those who may already have been working from home, obviously they should continue to do so if they can effectively work from home, if they're in the kind of work where that is possible. Obviously, everyone can't and shouldn't work from home, and many of us have to work in a physical business, and that's where maintaining that physical distance, using a mask where required, is so important to keep us safe. When we first talked about going grocery shopping, we said, make a list, go very purposefully, get what you want, and come back. And I think we need to make sure that we revisit that again, that we try to go as few people from a house as possible. Shopping shouldn't be a social event where you're meeting, people in the aisle, for example. And I think we just need to streamline and get some of that crowding down. And same for Christmas shopping. I think start early. Try to go at a part of the day when there may be less crowding. I think just planning some of those things, reducing some of the crowding, wearing a mask when you're at those retail locations, that will all have a significant impact, which cumulatively will help to bring our case numbers down. The other couple of signals that we are seeing is that we are seeing, I've always said that, place of worship, for example, on the whole, they've been very diligent. We've had, a few super spreader events, but we are now seeing transmission in place of worship as well in PA and Regina. In some cases, we have, when we've investigated, there was, people may not have been keeping that physical distance. There was some singing, mask use was not there. I think we all need to pay attention to that. Again, for those who have underlying risk factors, are more comfortable attending virtually, that's always an option. Most places of worship has supported that. If you do decide to go in person, pay attention to, not going if you're unwell, hand hygiene, physical distancing, mask use. And we all know that, talking loudly or singing in an enclosed place, I think does increase the risk. So just paying a little bit of attention to that, I think, will be important. So I think what we are trying to do is strike the right balance. Like, we've had a very successful 9 months. We have had overall low case numbers. We have, unfortunately, like the Premier mentioned, 25 deaths. We have had, hospitalizations. Some people have recovered quickly. Some have a slower path to recovery. The vast majority of our COVID positive cases have thankfully recovered successfully at home. So we've had a good, 8-9 months. We've had a beautiful week enjoying this fall weather. I think we do now tap on the brakes a bit as we get into the winter. We are starting to see the upward trend that the rest of Canada has been seeing. We weren't seeing it for quite a while now. Now we are definitely seeing that. But we really need to do all the things that we've mentioned that really are small things that can have a significant impact, and see if this makes the difference. And obviously, over the next 2 to 4 weeks, we'll see are we trending in the right direction or not. And obviously, if we're not, we'll have to further analyze what are the settings of transmission and what further measures would be required. Thank you.
Thank you, Premier. Thank you, Doctor. We'll now have time for questions from the room. Mark?
Manitoba was seeing similar case numbers to what we were seeing right now 2 or 3 weeks ago. Are these measures, are you hoping these measures stop us from getting to where they are now?
I think we obviously, I'm in constant contact with my colleagues in Manitoba, Alberta, rest of Canada. We have to look at our own context, and again, when I discuss on a daily basis with my colleagues within Saskatchewan, the settings are very different in Saskatoon compared to Regina, compared to Prince Albert, compared to the north. And, the local context is very important. In most cases, it's community transmission and gatherings in the household. In some cases, we've had super spreading events, so some cautions around that. But we really have to look at our own transmission settings and adjust accordingly. Obviously, we can always learn from other jurisdictions in Canada and even in Europe. But I think we need to follow the trends here and see how we can best address them with the minimal disruption in our daily lives.
Follow up, Mark?
Yes, many businesses have had mandatory masks in place and have had trouble enforcing it. How does the province plan to enforce masks in Saskatoon, Regina, and Prince Albert? And will there be fines for people failing to comply?
At this point, what I would like to request is that, the purpose of this is not to enforce right off the bat. The purpose is really to make it an expected thing for all of us when we're going to an indoor public place, so that, all businesses have signs saying, keep a 2-meter distance. If you have a smaller retail location, they'll say maybe 5 people can only come at a time. Some have, please wear a mask, some don't. Now it just makes it, levels the playing field of everyone. Just put a mask on when you're going in. It shouldn't be up to the business owner to request that. Obviously, if someone, doesn't has a specific reason why on that particular occasion they either don't have a mask or they can't put it on, I think that's fine. But one would expect a high level of compliance. And again, the thing is to always have it on you. I think if we all get into that habit, then it's just a simple thing to do.
I would just say to that, as well, we're not going to have a bunch of COVID cops that are out, traveling across the province enforcing mask use in our public spaces. This is about compliance, and this is about the onus being on us as individuals to do the right thing and wear a mask in our public spaces in these 3 centres. The onus is not on the business owner or the operator of the facility to enforce that. It is on compliance, and if we are able, in this case, and other provinces have experienced this, as Dr. Shahab has said before, when they do put in mandatory mask use in public spaces in certain cities, and we have seen that, the compliance does go up. Now, we already, I would say, have a fairly significant compliance here in the province, in particular in these centres, I would say. I've been in, in public spaces, and well over half of the people in these facilities, public facilities, are wearing masks already. If we can bring that up to a higher level of mask usage, that will help us curb the spread of COVID-19. But we need to remember a few things in addition to this. Mask usage does not replace physical distancing. It's in addition to physical distancing. So when we are wearing our mask, and now in these 3 centres, please don't let your guard down when it comes to keeping your hands clean, keeping some distance between you and the others that may be in that very same facility. But the onus is on us as individuals. This is about compliance. It's not about enforcement. And it has worked in other provinces. But we must also remember that this is a layer of protection. This is not the be-all and end-all, and doesn't in any way cure COVID. It's a layer of protection for us in addition to the physical distancing and everything else that we are doing to try to stop the spread of COVID in our communities, to try to ensure that we can continue to recover our economy, which is well underway here in the province, but most importantly, to ensure that we're keeping our family and community members safe.
We'll go to our next question on the phone line.
We have Daniela Ponticelli with Global.
You might be on mute.
Hello.
Hello
is this
there.
me?
Yeah, we got
it
you.
is. Sorry. Daniela from Global News here. I just wanted to ask, are we at the point of recognizing this as a second wave? I know we talked about the fact that Saskatchewan is seeing the same upward trend, but is the term second wave being used at all in this province?
So just very briefly, and this is be very much, a view from the street. I don't know what a second wave, third wave. Those are interpretations that maybe Dr. Shahab would speak to in more detail. But our numbers are up. They're up to essentially some of the highest numbers that we have had. Whether that is considered a second wave, so be it. We have bent this curve before. We have stopped the spread or slowed the spread of COVID-19 before in this province. And what we are asking the people of the province to do is to again reassess and ensure that we can lower these numbers, to ensure that we ultimately are keeping people safe in our community, but are providing every opportunity for us to continue with the economic recovery that is well underway here. But you might have more on what an actual second wave is versus higher numbers.
Yeah, the way I would like to, because in each province the dynamics are different, so the way I would like to describe it for Saskatchewan is that if you look at our case numbers on our website, we have had peaks and troughs throughout, and the initial peak was when we had a lot of international travel coming back in March, April, and then of course we had very low case numbers. Then we had localized outbreaks, in the northwest, in the southwest, and then very low levels otherwise. And now I think what's a bit different is that we are seeing sustained increases in several parts of the province, notably, Yorkton initially, but then they've come around. So that's also important. We saw an increase that was due to a few transmission events, but they came around. So that's also important to remember. And then now in the Prince Albert area, due to, initially a super spreader event, which also impacted the north and far north, and then Saskatoon, several large events, but then some secondary impact now, also impacting vulnerable populations like the outbreak in the lighthouse. And Regina, it's more, household transmission kind of propagation. So slightly different transmission patterns. And then if you look at the rest of the province, some parts of the province are a bit quieter, but we have pop-up cases now throughout Saskatchewan. So we definitely have more sustained transmission throughout the province with some increases in specific parts of the province. So it is a bit different from the previous kind of peaks that we've seen. And now our peak is getting higher. So I would actually argue that this is really our first true wave. And this is, our first true test in terms of as a province to actually turning this around. Because I think we did really well on working very hard when we had localized outbreaks. We've done really well in Yorkton, for example, in turning things around. But this is a bit broader, and I think that's why it needs all of us to, pull together and practice all these layers of protection more consistently. And we knew that as winter comes and the weather's changing this weekend, as we move indoors, we expected to see these challenges, and therefore the reduction in gathering sizes, the emphasis on all layers, including mask use, is so important now.
Follow up, Daniela? Danielle, do you have a follow-up question?
I was just curious as well, just going back to talking about leveling the playing field for businesses, that the onus is not on, obviously, individual businesses to ask people to mask. That this is allowing that to kind of give them a break there. Is there any reason why this wasn't implemented earlier for that exact same reason, to help level the playing field?
I think before September, our transmission rates were extremely low. And, I think many businesses were saying, please wear a mask, and that was great. But our transmission rates were low, and then a lot of the recreational time was spent outdoors. But now we were hearing about, situations where, one business would have a mask policy, another wouldn't, and then there would be some discussions about, well, why do you require us to wear a mask while this doesn't? So I think, this just says, just the purpose of this mandatory mask order is, it just says, when you're going indoors in a public place, whether it's, to pay your bill or to get your groceries or to into a retail location, just put a mask on. It also means when you're getting into transit or a taxi cab, put your mask on. And, I've said this before, our frontline colleagues in healthcare, in retail, driving our transit and cabs, they've been working throughout since March. And when transmission risk was low, their risk of exposure was lower. But they've always been wearing a mask that protects their customers. But now we owe it to pay it back. If we wear a mask, we protect them, and it is a bit of a reciprocity. And the reason now is that our transmission rates now are trending up. So the risk of transmitting is higher now than it has been before.
We'll take our next question from the room, Karen.
Said that mask use has been increasing, and that's obvious if you're out and about, and yet our numbers have been increasing. So some might argue that implementing a mandatory mask policy won't necessarily curb the spread. How would you answer those people?
Yeah, so that's absolutely right, that just having a mask policy on its own may not have the impact. I think it's all cumulative. So, there's now good evidence that suggests that then when overall mask use in indoor public places is high, around 80-90%, that itself can reduce transmission by around as much as 50%, but obviously not 100%. But all the other reasons for transmission count. Small gatherings where you can't have physical distancing is an issue. Large gatherings that are poorly planned is an issue. All these things are important, and not just one. But obviously you want to put in all these layers especially emphasize them when our transmission risk is high, or is higher as it is now, and hope that with all these interventions we can see things turn around. And again, I would like to emphasize that the cases we see today are cases who were exposed a week or 2 weeks ago. So, even though we're now putting all these layers and emphasizing them, we hope to see things turning around in a week or two, not before that. So just to point that out, we may well see our case numbers stay high or even increase for a week. But hopefully, if we can see things turn around in a week or two, I think that's great. And if it doesn't, and we continue to identify other specific areas where transmission is a problem, we'll have to look at those again. And again, we had issues with nightclubs where people were dancing and crowding and mingling. That was addressed through an order last week. We have seen that in general, bars and restaurants where people go and sit, at a table of 6, and that seems to work really well. Place of worship, again, in general, it's been fine, but we have now seen clusters, especially with this, lack of physical spacing, lack of mask use, especially when singing. So we have to then obviously identify those settings so that we can all course correct, but still be able to enjoy going to a restaurant or to go to a place of worship.
Follow up, Karen?
Yeah, there have been some questions about what actually constitutes a recovery. Especially we have these so-called long haulers, and I guess I'm wondering at what point is somebody recovered?
That's a really important question. So when we talk about active cases, that really shows us the community transmission risk. Because in general, what happens is you become infectious. You're told to isolate. So new cases are new cases that have tested positive, and then in general, you're an active case for 2 weeks. And then you exit the period of infectiousness, and that's why you have to isolate for 2 weeks. But of course, many people, recover uneventfully at home. It's a mild to moderate illness. In some cases, it can be quite draining, worse than influenza. But people, the vast majority, 80% plus, recover at home. But then, of course, we've had, I don't have the exact numbers, but we've had, more than 100 people who've been hospitalized, some in ICU. And there, some may even go to an ICU, but then recover quite quickly and get back to the full potential. For some, the recovery is drawn out because, there may be other complications of COVID, or even COVID itself can have complications on the heart, lungs, other organs of the body. So for some cases, the recovery can be quite prolonged.
And we'll take our next question on the phone line.
We have Laura Sharpatelli with CBC.
Hi there. If masks can slow the spread, why not make it province-wide? And why wait until, actually this has already been asked, why wait until now? But if it's, a lot of people are already walking around with masks, why not make it mandatory across the province so we could curb this easier?
So my recommendation actually is that we should wear a mask anywhere when we're inside in a public place. We're especially emphasizing it in these 3 locations because of the increase in transmission risk here. But my recommendation actually is province-wide. And we will have to see compliance, transmission, to look at that again, to look at that further if required. But hopefully, if we all have a high level of compliance, just like with physical distancing, if we can just comply at a high level and see our case numbers go down, this may be sufficient.
Follow up, Laura?
Yeah, so we're hearing there are delays with contact tracing and notifying people that they have been exposed to COVID-19. For instance, parents at One Day Care where there was an exposure waited more than 5 days. How stretched are your contact tracing resources right now, and what is being done to address that?
Yeah, I'll make some comments and then I'll ask Mr. Livingston for comments. But, this is so important for all of us to do the things that I've mentioned before. Stay home if you're sick. If your symptoms continue, to get worse, seek testing, but continue to isolate. We should all be able to count the number of contacts. We heard this. I said we should reset our bubble, but then we heard that we all have overlapping bubbles. And some of us had less than 6 contacts if we were a case. Some of us had dozens of contacts. That makes contact tracing more challenging. So again, we all need to look at, if I was to become a case today, how many people would I name as close contacts in the last 3 days? And I shouldn't have to name more than 4 or 5. We all need to conduct ourselves at work, at play, in a way that we minimize, for the most part, the number of close contacts we all have, because that's how then public health can, obviously the lab needs to keep up with testing and reporting results, but then public health has to stay on top of testing and contact tracing very quickly. But if our numbers of cases go up and our number of contacts per case go up and they're very complex, then the whole, the capacity is ramping up, but the whole process gets more complex. And I'll see if Mr. Livingston wants to add to that.
Yeah, thanks, Dr. Shahab. So, as you know, with the surge in cases, that has been a true test on the lab and contact tracing, but in both areas, particularly lab and contact tracing, we're expanding staff on an ongoing basis. We are still meeting our target of over 90% of contacts and people notified when they are positive within that 24-hour period of time. And as I said, we are expanding the staff as we speak. We have 19 more individuals identified internally that will be moving into contact tracing over the next little while. And we will continue to expand contact tracing as required to meet the demand based on what we're seeing for caseloads. And we are planning to add enough resources for a much higher number of cases on a daily basis. Without knowing where we're going to be in a few weeks, we are preparing for the caseloads to go up.
And we'll take our next question from the phone line.
We have Zach Becerra with the Star Phoenix.
Hi there, Dr. Shahab with Premier Mo. Thank you for taking the time. I have a question about daycares and school spaces. Schools, for example, have, in some cases, rules that says that children under a certain grade level don't have to wear a mask. But now, as of Friday, in our 3 largest cities, everyone over the age of 2 will have to wear a mask. Which one of these policies wins out in the day?
So schools specifically are not mentioned in the order because they have their own layers of protection, including where required mask use, especially for grades 4 to 12. And many schools actually in these jurisdictions are, opting to have mask use, not just in common areas, but in the classroom. So schools are not impacted by the order. And I must say that, schools have done exceedingly well. Even though we have had increases in community cases, and we expected to see the odd case show up in school, most of the cases are limited to one case, acquired in the community, and then, may have attended a day in school or may have become symptomatic, but we trace 2 days before onset of symptoms. So a child who went to school Monday, Tuesday, stayed home on Wednesday because the child was symptomatic. We do trace back to the school and other settings for contact tracing for Monday, Tuesday. But, I think we need to recognize the tremendous work that, teachers, staff, school divisions, parents, and children have done. I think I would say if you want to learn how to wear a mask, ask a 6th grader, because they do it really well, and I think that's really a lesson for all of us.
Follow up, Zach?
Yes, I have a question about another part of the new rules. I noticed that there's also an exception for people who are engaged in physical exercise at a gym, for example, or on an ice rink. We've had multiple outbreaks reported at gyms, including an event that I think was typified as a super spreader event in Yorkton. Why are we making this exception for those spaces, given that we have so many cases linked to them?
Yeah, I think we have to strike a balance. And again, for the most part, gyms, restaurants, bars have done really well. Even when there's a super spreading event, public health goes in, works with the facility, whether it's a gym or a restaurant, goes over the layout. In most cases, the guidelines are being followed. In some cases, they identify that there's a bit of a crowding happening, maybe after exercising, people are getting together or whatever. We know that the purpose is not to reduce transmission risk to zero. We know that there's a low transmission risk when we're out and about. We want to keep that as low as possible, and we want to prevent super spread events. So there's a detailed investigation, and then there's advice to the facility if there's a significant transmission event, as has happened in 2 gyms. And then any learnings from that are then introduced back into our reopened Saskatchewan guidelines if required. So that's an ongoing process to improve the guidelines as well if required. But again, I think we should not expect that there would be no transmission events. But again, business owners have a role, but we as customers also have a role. Don't go to restaurant, bar, gym if you're feeling under the weather. In hindsight, we found that someone got tested on Wednesday with a fever. when public health interviewed, they said, you know what, I did have a headache on Monday, but I decided I'll work it out at the gym. Again, and then, you have to go back 2 days from Monday because, there's a risk of transmission for, 4 days now. And I think we just need to be very, read all the symptom list on the self-assessment tool. And if you have any of the symptoms, however mild, don't go out to a restaurant, bar, or gym, stay home from work. If your symptoms get better, you can go back to work, you can go and exercise. If your symptoms progress, obviously, fever, cough, get tested, and I think that's what we need to do more consistently.
We'll take our next question from the phone line.
We have Britton Gray with CJME.
Hello. So you talk about this mandatory mask, how you're asking for compliance from everyone on it, but there is a large group of people who are completely against masks, and some might even go out of their way to not wear a mask. And I imagine some business owners might not want to implement a mandatory mask policy. So what kind of consequences are there for people who go out there? Is there going to be kind of enforcement on it?
What I would say is that, I think we need to just think of each other at this time. I think there's a time to make a point, which you can do, out in the open. But, going in and subjecting someone who's running a business, because you may be going in once without a mask, but a person who's running a business may be seeing dozens of people in a day. And I think we owe it to each other to protect each other because, if I'm going to develop COVID symptoms tomorrow, I may be infectious today. So if I'm feeling well, and not wearing a mask, I can't guarantee that I'm not transmitting to someone else. And I think that's why it's so important to be more consistent with mask use. It is mandatory to the public health order in these 3 locations, but I think it's also a sign of consideration. We may think that it's an extra burden, or we don't really think it works, but it's a sign of consideration at this point. And the evidence generally shows that if all of us wear masks most of the time or all of the time, it does have a significant impact on overall transmission.
I would just say there's, the couple of initiatives here today they're temporary for the next 4 weeks, for 28 days, is to, help us in this province to bend our infection rate and to bend our numbers. Listen, we've had 9 months of very strong numbers here in Saskatchewan, very good numbers when it comes to our conversation around COVID spreading in our communities. Those numbers have surged over the course of the last number of weeks, and so we're putting in a couple of initiatives here under Dr. Shahab's advice and his team's advice that we think will help people in Saskatchewan curb that spread. Will they work on their own in reducing these numbers? No, they won't. Like I say, the masking policy on its own will not reduce the spread. We need to continue with our physical distancing. We need to continue with all of the other things that we are doing in addition to the masking policy. And hopefully in 28 days we can be having a very different conversation around where we are. There's been masking policies put in other provinces and other cities across Canada, and quite frankly, those areas of Canada have much higher numbers than we do here in Saskatchewan, even with a masking policy. So it on its own will not reduce the spread, but it will be an accumulative or an additional measure for us when combined with all of the other initiatives that we have in what we hope will be slowing the spread of COVID-19 in our communities and bending this number down from 842 active cases to a lower number. Because if we go back to the question around COVID in our schools, and I would echo Dr. Shahab's comments about the effort that our educators and our school employees are making in school after school across this province. They are enacting a plan and doing so very well, and the numbers are bearing out with that. But the best way to keep COVID-19 out of our schools is to keep it at a very low rate in our community. The best way to keep COVID-19 out of the gyms and the places that we might physically exercise is to keep it out of our communities. The best way to keep our families safe in our communities is to keep that infection rate low. This is a tool for us in a few settings, 3 major centers where we've had a few super spreader events, as well as our family gatherings where we will let our guard down. And I think we're all guilty of that at some point over the course of the last few months, of letting our guard down in a family home or in a friend's home where we feel safe. And this is just a reminder that we can't do that. We can't let our guard down. We need to ensure that we are approaching this virus with vigilance each and every day so that we can ensure these numbers are low, so that we can ensure that the infection rates in those places in our community, like our schools, our long-term care homes, our gyms, our community events are continue to be low, like they have been over the course of the majority of the last 9 months.
Follow up, Britton?
Yeah, I'm wondering if Dr. Shahab can maybe clarify something he said earlier. I think I heard that his recommendation would actually be for mandatory masks province-wide, but that hasn't been taken. I wonder if you could clarify that. And then why hasn't the government, if that is his recommendation, followed through with that to make it mandatory everywhere?
So I'll just go back to June when I did say that in summer when you're out and about you don't have to wear a mask, but we should all start getting ready for the fall when we should all have masks to use at hand and practice wearing a mask at home or when we're in an indoor public place. And then I started emphasizing that even when our case numbers were low in August and September and over October. So I think my recommendation remains unchanged that when we are in an indoor public place anywhere in Saskatchewan, we should wear a mask for the time that we are in a public place with people who are not part of our household. But it's become especially critical at this point for the PA area, Saskatoon, Regina, because the increase in active cases. But my recommendation is the same for all over Saskatchewan. And like I said, even today, that if you are driving somewhere and you're at a busy interaction, there's people from all over at a grocery store or a gas station, put the mask on. We have seen transmission at those locations in Saskatchewan. And, while you have to have, for the most part, your risk is high for those prolonged contact in an indoor public place like at a personal gathering, you can have occasionally transmission even with for a smaller duration of exposure in a washroom, for example, or in a retail location. So my recommendation is that we practice all the layers: physical distancing, sanitizing our hands, and wearing a mask in an indoor public place consistently.
I would just say there's a difference between a recommendation and a public health order. Dr. Shahab has been clear, as we've been clear from day one on our masking policies. If you're not able to create that distance, you should wear a mask. You should consider wearing a mask regardless, as our numbers have surged over the course of the last couple of months. In our major centres, there's now an order in place as of this Friday for the next 28 days where people, if you are in a public indoor place, you do have to wear a mask, and we're asking you to do that. Listen, we're at a little bit of a fork in the roads here in Saskatchewan, and it was mentioned earlier that we're at numbers that Manitoba had just 2 to 3 weeks ago. Let's take a different path. Let's reevaluate what we're doing each and every day, and let's not allow these numbers to get up to much higher, 100, 150 a day. Let's take a different path and get these numbers back down to maybe a 10 or 20 or 30 a day, ensure that our community infection rate is low, thereby keeping our schools, our long-term care centers, our communities safe, and keeping our families safe. There is an opportunity for us to do something quite different here, but we all need to do it. We all need to take our personal responsibility very seriously. I don't like wearing a mask any more than anyone else, but I'm going to do it to keep those around me and those that I care about safe.
We'll take our last question on the phone line.
We have Ryan Kessler with Global.
Good afternoon, and I appreciate all the information you provided on COVID-19 so far. If I can just switch gears to the other big news event of the day, to the Premier, I'm just wondering what your greater concern is with the U.S. election, whether it's continued isolationism from Donald Trump or Joe Biden's pledge to scrap Keystone XL.
Well, yeah, the concerns I have aren't really with an either-or of the administration. They are with what that administration may do on certain issues. And we have had, we do take issue with Mr. Biden, should he become the president, that he would shut down the construction of Keystone XL, which we would say is not only an important piece of infrastructure for Western Canada or Canada proper, but is an important piece of infrastructure to ensure that we can continue to provide the North American market and the global market with sustainable, competitively priced, high quality energy. and is good for the economy, both on the north and the south side of the border. That's a policy initiative that Mr. Biden has put forward that we would take issue to here in this province. We've taken issue with a number of policies that Mr. Trump has put forward over the course of the last number of years. We've been in Washington as well as other areas of the U.S., discussing just those issues at the highest level of the Trump administration. Section 232 on steel was a challenge for Saskatchewan. Aluminum was a challenge for other areas of the Canada. We banded together with other premiers to work on just this issue. The potential for it at one point in time on Canadian uranium, which is Saskatchewan uranium, was something that we engaged very heavily on to ensure that didn't come to fruition, and we're thankful that didn't come to fruition here. So listen, whoever is successful here this evening, here's what I would hope for, is that there is a decisive outcome, so that we all know, north and south of the border, who the president is, so that we can ensure that we can plan our engagement from Saskatchewan's perspective, and I know other provinces will be doing the same, so we can plan that engagement to further our relationship with our largest trading partner. The U.S. is Saskatchewan's largest trading partner. We work on a province-to-state basis with many of the states, and we work most certainly on a province to the federal administration, the presidential administration, with the cabinet ministers that are there, as well as senators and members of the House. And that is going to continue, and we will most certainly be hard at work in the days, weeks, and months ahead to continue with the positive steps towards truly more competitive, more sustainable North American economy.
Follow-up, Brian?
Yeah, and you mentioned uranium and steel and the general trade environment. I'm just wondering if, given the fact that the new NAFTA has been crafted now, how do you feel about Saskatchewan's trade standing with the United States compared to 4 years ago?
I think we're in a very good position with our trade standing with the United States, regardless of who wins the election here tonight, which administration we move forward with. We have a long-standing positive trade history with the U.S. I told the story when we were down in Washington at one point of how we bring tractors in from Fargo, North Dakota, combines in from East Moline, Illinois, to harvest crops that are treated with crop protection materials that are brought in from other various states across North America. We then turn around. Quite often we'll send oats down into the Iowa area to be processed and provided to the world. At the very same time, we'll be bringing in peas and pulse crops from the northern states, Montana and U.S., that will go to processors right here in Saskatchewan, then be shipped around the world. The agriculture is one industry that is extremely integrated across the border, but so are our other industries in Saskatchewan, manufacturing, mining, most certainly our energy industry. We talked about KXL in a previous question. There is a real cause and a need for us to continue to engage with at all levels in the U.S. Due to the integration of our economy, yes, but also striving to ensure that the North American economy remains competitive, remains an economy that can provide goods not only to one another here in North America, but can provide those sustainable, competitive, high-quality goods to people all around the world. And we should never lose sight of the fact that we have that. We had it under the original NAFTA. We have it under now the USMCA. I think Saskatchewan is well poised, not only with our relationship with the U.S. as we move forward, but extremely well poised to recover and grow as the world starts to recover in a post-COVID environment economically. We have what the world needs. We have the food, we have the fuel, we have the fertilizer, and it is sustainable, it's high quality, it's competitively priced, and we are one of the most secure supply chains that you can find around the world. The world, quite frankly, needs more of what Saskatchewan can provide, and we're going to position this province in the best possible place to provide it.
Thanks very much for joining us today, everyone. That concludes your time.